satisfy all your needs. Probably the biggest need, and every Ukrainian can help with that, that is a moral support. Moral support can be in a form, especially of children's support. That is probably the most valuable. To send a letter, to write a letter to a wounded soldier, to send a letter to our soldier who is in the east, and to express gratitude. And we're proud of them that they defend us, and they defend our peaceful September 1st, and we owe that to our men who defend us in the East. All the rest of the problems in the hospitals, you can see that in Volunteers 100 in the Facebook, and we publish the needs of our hospitals and other hospitals. We cooperate with all the hospitals of Ukraine where we have our wounded. First of all, like everyday things they need, like also wheelchairs, mattresses, and because special medical mattresses, and they need special mattresses. You heard that in the Ministry of Defense, a representative of the head of the medical department, he told at the press conference that hospitals are provided. Yes, probably military hospitals are provided well, but there are some other hospitals that receive our wounded. For example, a hospital of emergency in Mariupol, a hospital in Bila Tserkva, in Poltava, and in other cities that ask us to provide support, medical, with medicine. They also need equipment, medical equipment that breaks or burns, so to say. So we help to renovate, or we provide new equipment, medical equipment. Also, there is a good initiative. We are thankful to our mayor, because he, together with Radutsky Mikhail, they prepared 10 ambulances for the east, but those vehicles are not provided with anything. They're not equipped. They asked volunteers to help with equipment, with defibrillators and sets of bandages, and we'll try to cover that to satisfy that need, but those things are very expensive. That's why we need assistance of all Ukrainians also, because 10, that's a too big number. That's in addition to that, we have to outline problems with assistance to the wounded. It's important to evacuate them from the battle field, in order that not every vehicle can reach them, not every car or ambulance, and the battalions need armored vehicles that equipped for ambulances, for them to be able to take the wounded away. Also, they need cars which are called tabletочка, a pill. And Savelut Stibluk, who's a doctor and a car was, it is called Zuzha. That's the only car that was in a column that was trying to get out of that of Ilovaisk, and that car survived, and his team survived, even when the mine exploded somewhere not far from that car. He was just kicked out, lost consciousness, but then he survived, and he took away 87 wounded on that car. So they're not that expensive, such cars, and they are needed. Doctors need such cars in ATO area for them to provide mobile assistance, mobile medical aid. One more, like portable first aid kit, and for those kids that should be Ukrainian, but they should be like in NATO. We agreed it will happen, and representatives of the Ministry of Defense they said it's quite expensive. We're ready to help with these first aid kits, and there are some volunteers who work only on this issue, nothing else. In general, they would help, they would cooperate on that issue. One more thing, technical medicine is very important, and how to provide assistance to yourself. You need to listen not only to theory, but also you have to train. You have to learn how to do it when there is a fire or shelling, because combat conditions, that's very different. And not every doctor, not every medical staff can provide under shell, and not always can provide give medical aid, first aid, and we need to train instructors who can share the knowledge to our soldiers in battalions. That's how it should work. Also, there's a problem with coordination where our soldiers are, and we volunteers ask in every hospital where we have wounded people from it to appoint one person who's responsible for coordination or work with volunteers. It's very important that person will be responsible for ordering medicine, medical equipment, for finding our soldiers. So for communication, that person will be responsible for communication with volunteers. You know that our soldiers, they are surrounded. For them, we understand that such situations can happen. They should have reserves for one box to be for 10 people, for example, first aid for 10 people. We should have such reserves for ATO near hot spots. They should be there. That's in general. That's our plan of how to help to wounded and how to coordinate work better. I know that state structures working on that. There is one coordination center, and I want it to be created sooner and to start working sooner, because I'm not afraid the state service on rehabilitation and social adaptation of wounded soldiers. They talk about that for a month, but no results. Who will be the head of the service? Who will work in it? So we don't know about that. So these are what should be changed today. There should be more coordination between volunteers and the authorities. And thank God they hear us and they listen to us. And I hope that next week, it was announced that there would be a meeting. There will be a meeting with the president, and I ask all volunteer groups who see us and who know about us. On Facebook, there is a form just to help to coordinate our work, because all of us, we spoke about ATO and about the problems, but we didn't discuss about the issues of wounded soldiers and of IDPs. So put questions to the president in that form, include that, and also what you are ready to provide already. Don't come just with questions. Come also with offering something to do. And whom would you like to see? And every volunteer who's facing problems, they know public servants and who can solve their problems. I would like them to mention those people for them to come to that meeting, and should give answers in front of the president why one or the other problem is not solved. So, how can you assess the the authorities when you speak to Ministry of Defense, MOD, or Not always. Like I have positive answers. Sometimes they say yes or no. Sometimes they are in ATO. They don't call back. As to Ministry of Defense, we have the best cooperation with them. Ministry of Social Policy, we have a dialogue, but are you working with on IDPs? No, we are working with wounded soldiers, and we are working on rehabilitation. We have a dialogue and with within the Ministry of Social Policy, that department will be created, because that was the initiative. But there are questions: who, when, what. So let's speak about Ministry of Healthcare. That should be a key ministry. It's not a key agency for us. We don't have communication. We have the least communication there. We invited all pharmaceutical companies to provide assistance to ATO area, and for us to come to conclusions what the lowest prices they can offer for us, and we have a dialogue with them. So pharmaceutical companies, do they give you discounts? There are some companies that told they would provide humanitarian aid to them. I understand that we are not the only ones that cooperate with them. Maybe they cooperate with others. But thank God we had a dialogue. As to the Ministry of Healthcare, during last time I saw them, it was not positive, because the questions I asked, the answer was Minister of Healthcare is not responsible for this, and for that. I was tired to hear that they are not responsible for something. Why we volunteers? Why are we responsible for everything? Maybe that's why we are better than public servants, because when there is a task for us to solve, we don't have a word, it's impossible to solve it. We are trying to do something, yes. Something may not work, something doesn't happen with us, but we are trying to help people when they speak to us. Any question? No question. I have a question. There are a lot of organizations who organize assistance from abroad to our soldiers. There were representatives who organize special beds. Do you cooperate with donors from abroad? Do you receive financial support from abroad? We didn't have broad cooperation. Last time we received aid that our Ukrainian businessman, he bought from Germany such medicine which is used for surgery in hospitals. He decided to. It came for Ukrainian armed forces, that's assistance, but we wanted also to cooperate with the Ministry of Defense, and he wanted also to be distributors of that aid. And now we, with Mr. Shidrak, and we will distribute it under his guidance. As to people write letters, and but they must trust the structure where they invest, and they should know someone. They should see their work practical. They should see reports on Facebook, for example. They should see concrete work of people. Then you can decide with whom to cooperate. In Facebook, you write it in Russian, Volunteerska Sotnya. Can we have updates on your needs? Yes. And also, we work in Kiev, military hospital. They all failed, so that's why the wounded soldiers are sent to medical city and to other hospitals. So there are some other volunteers who take care of hospitals. We are trying to cooperate because everybody should know the goal. We would like to help our wounded soldiers. I would like them to be healthy. Natalia, I have I have wish. I wish you succeed, and I applaud to you, and I bow to you. Thank you for your support. It's very important because sometimes we don't have any energy because we're not made of steel. And thank you very much for your support, and thank you once again. I bow to you for your work, and greetings to all your girls. And I know that you have a lot of women who are working in your or girls who work in your group. Thank you very much, and I would like to thank our soldiers who defend us, and I wish them to come back alive, and those who are in the hospitals, I wish them health. With such girls and women around them, they will become healthier sooner. They will recover sooner. Next round table is at 3 o'clock.